Dear viewers, welcome to the Healthcare Communication Skills series. This is the second talk of our series in which we will try to see what is necessary to build a connection between the patient and the physician and the allied health services and how to build a trust between their relationship. So we will start this talk by now. Rapport is the emotional connection between the caregiver and the patient, and between them, the connection is the trust. This trust allows honest communication and adherence to the values and culture, and it results in healing and better outcomes. So, without this trust, it is not possible to treat a patient or to trust on the caregiver, because if the trust is not there, the patient will not follow the advice, and the allied health caregivers, which are attached in the same team, cannot have confidence to treat that patient efficiently. So it is better that first the rapport and the trust should be developed. Even the best treatment plan fails if the trust is not proper. Now, when the trustable relationship between the patient and the physician or the nurse or the allied healthcare services is built, the patient feels confidence to share his or her details with them, and it helps in the treatment of the patient and management of other ailments and associated psychiatric illnesses also, which is already attached with the patients and their disease patterns. So it encourages truthfulness and encourages the adherence of the patient with the treatment. When the patients feel heard, they share vital details. So good rapport prevents misunderstandings, and it improves cooperation, and it will help in treating the patient in a better way. It leads to rapid healing and better outcomes. Now, now we will discuss how we build the trust. So when we go to the patient first time or second times, we have to introduce ourselves. If the patient we are meeting with the first time, we have to introduce ourselves. We define our role and tell the patient that you are here to treat their ailments and you are here to listen to them. It builds a rapport and the confidence, and it helps in maintaining the positive relationship between the patient and the physician or the allied healthcare services. So you have to maintain an open posture, a clear eye contact with the patient. You have to talk very smoothly with a calm tone and does not raise your voice, and with an attentive attitude. Also, speak slowly. Small gestures of showing the respect will increase the confidence level and trust. Don't interrupt the patient in between. The first contact determines the trust. A smile, a clear introduction, and an attentive listening makes the patient feel safe and valued. So, what are the components of communication? When we talk with the patient or anybody else, the 7% counting is the words. Words count for the efficiency for 7% only. The tone is 38%, that with which tone we are talking to the patient or their relatives. And 55% is our body language, how confident we are, how powerful grip we have on the topic with which the patient is suffering the disease of the patient. We have to listen to the patient, also their relatives, attentively without distraction. And whenever they are talking, we nod our heads so that we give them the message that we are actively listening without distraction, without seeing the mobile, without seeing the things around us, anything. Be fully attentive and present all the time. Patients read our tone and eyes more than our words. Silence and attention are powerful tools of empathy. So we have to build our trust through empathy, tone, body language, and showing confidence that we know their illnesses and we want to treat them in a better way. We have to be consistent in our communication. We have to admit our delays in management. We have to admit our loopholes in the process and clinical pathway. It builds our trust, it builds the confidence because some things are natural. Patients also see the loopholes in the management. So you have to tell the patient clearly that what is in your hand and what is beyond your scope of service. But you have to preserve the confidentiality of the patient's status, disease, and patient's process of management. Trust is built by reliability and honesty. When you can't promise the results, promise effort and communication. Tell the patient that I will try my best, and what you will try your best, you will tell them the process how you will try the best so that it builds the confidence in the patient that you are trying your best possible efforts according to your circumstances to do the facilitation of healing of his disease or her disease. Now, what we don't have to do is that we don't have to rush to the patient for asking the questions very fast and confused attitude and medical jargons, interrupting the patient frequently. We have to listen to the patient. Patient will feel ignored when we show our attitude that we are in hurry. It will not increase the importance of the physician by showing the attitude that the physician is very busy in managing their patients other than the patient which he is talking or she is talking. So we have to show the patient that you are fully attentive to this and only this patient so that it feels it feels by the patient that you are trying to help him and you are the only one which can lead them to the healing pathway. So, summarizing that talk, we have to say that trust is earned through empathy, honesty, and respect. Listening is more healing than talking. Every interaction with the patient or their relative counts, and they take the impression about your personality, your skill, and your ability to treat them. Rapport is not an extra management, it is a part of the treatment. It humanizes care and strengthens the doctor patient relationship. So, it ends our talk for building the rapport and trust between the patient and the doctor and the relatives. Thank you.